Hello everyone, I'm Seçil. This presentation is about phototherapy and devices about phototherapy. Shura and I will give some information about this topic. Firstly, I'm going to talk about the history of phototherapy. Phototherapy has been used to treat medical conditions for as far back as 3,500 years ago, when ancient Egyptians and Indians used sunlight to treat skin conditions like vitiligo. Modern phototherapy using artificial light sources begin with Niels Rieberg-Finsen, widely regarded as the founder of modern phototherapy. He treated a skin condition called lupus vulgaris with sunlight and ultraviolet radiation. From then on, usage of phototherapy in medical fields grew. Techniques were refined and developed, and it eventually gained widespread acceptance. For example, the Greek civilization was also one of the great civilizations that believed in power of sunlight. The name heliotherapy was first used in the 2nd century BC by the Greek doctor Hippocrates. Hippocrates taught the value of sun exposure in the restoration of health. Hippocrates introduced the benefits and healing powers of sunlight from his journeys to Egypt, where sunlight treatments were well known. Even the Greeks had a famous city called Heliopolis, City of the Sun, that was well known for its healing temples and light rooms containing windows covered with specially dyed cloths. What is phototherapy? Phototherapy is a type of medical treatment that involves exposure to fluorescent light bulbs or other sources of light, halogen light, sunlight, and LEDs to treat certain medical conditions. Phototherapy is also known as light therapy and heliotherapy. There are different types of phototherapy and kinds, as well as the technique used by your doctor will depend on the condition you have that is being treated. It often uses ultraviolet UV lights, which reduces inflammation and slows down the recreation of skin cells. For some people, over-the-counter prescription creams are enough to manage psoriasis. So, what conditions can phototherapy treat? Phototherapy can be prescribed to treat many forms of eczema and psoriasis in adults and children and helps to reduce itch and inflammation. It is used for eczema that is all over the body widespread, or for localized eczema, such as hands and feet, that has not improved with topical treatments. The most common type of phototherapy used to treat eczema is narrowband ultraviolet B lights, although the other options may be recommended by your healthcare provider, including those that use ultraviolet A lights. Treatment with phototherapy uses a special machine to emit either UVB or UVA lights. Also, mood and sleep disorders. Phototherapy is also used to treat mood and sleep disorders, although it's most commonly referred to as light therapy in this context. The major conditions it is used for are seasonal affective disorders, SAD, and circadian rhythm sleep disorders. Light therapy for SAD involves using a light box, especially designed box that emits soft light at a standard wavelength. Light therapy used this way has a number of minimum side effects, and some of them are headaches, fatigue, insomnia, hyperactivity, and irritability. Now we can talk about the types of phototherapy. Ultraviolet light B, UVB, is present in natural sunlight and is an effective treatment for psoriasis. UVB penetrates the skin and slows the growth of affected skin cells. Treatment using UVB can include UVB phototherapy, excimer laser, and in-office or home UVB Phototherapy. UVB phototherapy treatment involves exposing the skin and artificial UVB light source for a set length of time on a regular schedule. There are two types of UVB treatments: narrowband UVB and broadband UVB. UVB treatment is offered in different ways. This can include small units for localized areas, such as the hands and feet, full body units, or handheld units. The excimer laser, approved by the FDA for treating chronic localized psoriasis plaques, emits a high-intensity beam of UVB, and it can target areas of the skin affected by mild to moderate psoriasis. Narrowband ultraviolet B light therapy is the most common form of phototherapy. It can be used to treat plaque or guttate for psoriasis. However, narrowband UVB light therapy is most effective when performed 2 or 3 times a week. According to 2002 study, people who had twice weekly sessions saw their symptoms clear up in an average of 88 days. Those with sessions 3 times a week saw their symptoms clear up in an average of 58 days. A 2017 study showed that around 75% of people receiving narrowband UVB treatments found it cleared their psoriasis or led to minimal symptoms. Narrowband UVB treatments may prove more effective when combined with topical treatments, such as with vitamin D analogs and corticosteroids. Broadband ultraviolet B is an older form of phototherapy than narrowband UVB. The two treatments are similar. There are 3 main differences between them. Narrowband UVB light bulb release a smaller range of ultraviolet lights, may clear psoriasis faster and produce longer remissions, may require fewer treatments per week. And plus to them, we can talk about the last type of phototherapy. PUVA is the combination of solar and long-wave ultraviolet radiation, UVA, that slows down excessive skin cell growth and can clear psoriasis, some other several severe skin conditions. Solaran is a drug taken by mouth that makes the skin disease more sensitive to ultraviolet light. This allows the deeply penetrating UVA band of light to work on the skin. Oral PUVA comes with the highest risk of drug interactions and side effects. It's most effective when combined with an oral alternative. Bad PUVA works best for the adults with moderate to severe plaque psoriasis. And side effects of PUVA therapy: dryness of skin, nausea, itching, keratitis. Some other types of phototherapy that either aren't as effective, widely recommended, or widely used are sunshine therapy. Although both UVB and UVA are found in sunlight, UVB works best for psoriasis. UVB from the sun works the same way as UVB in phototherapy treatments. This treatment may take longer to work than a UV lamp, and it also increases your risk of skin cancer. You need to cover your unaffected areas with sunscreen and slowly increase your time of exposure of the sun. Start with periods of only 5 to 20 minutes. If you live farther south, that period is even longer. People who are using PUVA or other forms of light therapy should avoid exposure to natural sunlight unless directed by a healthcare provider. People who are using PUVA or other forms of light therapy should limit or avoid exposure to natural sunlight unless directed by a healthcare provider. They can increase the risk of sunburn. Tanning beds are also no substitute for doctor-supervised light therapy. The National Psoriasis Foundation (NPF) reports that tanning devices can't stand in for phototherapy treatments. That's because tanning beds use UVA, which doesn't help psoriasis unless combined with certain medications. Moreover, the use of these machines carries a much higher risk of skin cancer than medically supervised treatments. Some people visit tanning salons as an alternative to natural sunlight. Tanning beds in commercial salons emit mostly UVA light, not UVB. As we see here, the FDA reclassified sun-lamps from Class 1 low risk to moderate risk Class 2 products. It can cause premature aging and increase the risk of skin cancer. Phototherapy is also treats severe jaundice in the neonatal period. Phototherapy is a safe, effective method for decreasing or preventing the rise of serum in unconjugated bilirubin levels and reduces the need for exchange transfusion in neonates. Phototherapy is used to treat newborn jaundice by lowering the bilirubin levels in your baby's blood through a process called photooxidation. In this way, photooxidation adds oxygen to bilirubin so it dissolves easily in water. This makes it easier for your baby's liver to break down and remove the bilirubin from their blood.
Devices about phototherapy. Two types of phototherapy devices are currently available: the conventional phototherapy light and the fiber optic phototherapy device. The common light sources used in these devices are either fluorescent or tungsten, halogen lamps with wide emission spectrum, or light-emitting diodes with narrow spectrum. How does the phototherapy device work? Three main factors determine the effectiveness of phototherapy devices: the wavelength of light, the surface area of the exposed skin, and the intensity of the light. Phototherapy light oxidizes the bilirubin in the blood, thus producing compounds that can be eliminated from the body. The unit consists of a bank of 20-watt fluorescent lamps positioned 30–40 cm above the infant. Commercial phototherapy devices are designed to produce maximum illumination at wavelengths close to the absorption maximum of bilirubin while minimizing exposure to either infrared or ultraviolet radiation. Halogen spotlights. Halogen lamp sources deliver phototherapy using one or more quartz halogen bulbs. It is possible to achieve sufficient irradiance with halogen light sources. However, devices designed with a single lamp produce a circle of light with high irradiance only in the center. Halogen systems are compact and caregiver-friendly. However, quartz halogen bulbs carry the disadvantage of generating significant amounts of heat. A newer device that incorporates a metal halide bulb is an improvement over earlier halogen spotlights. The light source is located in a light box away from the infant, resulting in a cooler light surrounding the infant. Fluorescent tubes. Often referred to as a bank lights, fluorescent tube phototherapy devices have been around the longest. It is vital to realize, however, that not all fluorescent tubes are the same. Dramatic differences exist in the irradiance produced by different types of fluorescent tubes, even within the same 425 to 475 nanometer wavelength. Bulbs used in this type of phototherapy units include daylight, cool light, blue, spatial blue, or a combination of these. One system contains 6 blue tubes and the 2 white tubes with an optional on-off switch. Caregivers are often bothered by the blue hue effect produced by all blue tubes, and the blue lights can impair assessments on infant skin color. Fiber optic blanks. The blank realizes waves of blue or white light. When these are absorbed in the skin, bilirubin breaks down and is eliminated from the baby's bloodstream. This lowers the yellowing effect in the baby's eyes and skin. Fiber optic devices contain a tungsten halogen bulb that delivers light via a cable into a plastic pad containing fiber optic fibers. The pad remains cool and can be placed directly under an infant to increase the skin surface area that is exposed. The light is generated from an illuminator into a fiber optic panel inserted into a safe cushion's cover. Because the system uses pure light energy, no electricity or heat is generated near the baby. No light can be seen by the newborn, so eye pads are not necessary. Home phototherapy. Treating psoriasis with a UVB light unit at home can be an economical, convenient choice. Home UVB can be quite effective in controlling psoriasis, but it requires a very consistent treatment schedule. Patients are usually treated initially at a medical facility and eventually begin using a light box at home. However, all phototherapy requires prescription. A dermatologist experienced in home phototherapy will provide instruction for the schedule you should follow. Home phototherapy is a medical treatment and requires monitoring by a medical professional. Adverse effects of phototherapy. The most noticeable clinical complication of phototherapy is bronze baby syndrome, a grayish-brown discoloration of the skin that occurs exclusively in infants with cholestatic jaundice. Bronze baby syndrome is believed to occur when the brown photoproducts of porphyrins, especially copper porphyrins, accumulate in the skin and their excretion is impaired by cholestasis. Phototherapy can damage red blood cell membranes, increasing their susceptibility to lipid peroxidation and hemolysis. Recent evidence also suggests that phototherapy impairs immune system function through alteration of cytokine production. Phototherapy has been linked to the development of abnormal melanocytic nevi when the children become older. The evidence for this association is not definitive and has been debated, but at this time this possible effect cannot be ruled out. For more than 40 years, phototherapy has been the standard of care for the treatment of hyperbilirubinemia in the newborn. In retrospect, phototherapy may have prevented nearly as much morbidity and mortality in neonatal care as the use of oxygen and has certainly done so with fewer complications. Because we have become so comfortable with this simple therapy, however, we must guard against becoming complacent about the disorder that we are treating. And there are questions we prepared here. Thank you very much for listening. I hope it has been enjoyable and informative.